Strictly, who's going to be joining us a bit later on the programme today. First, let me share this story with you because a new technology to diagnose breast cancer developed in a lab in Newport Pagnell has won a business award by the Institute of Physics. Digistain says its technology, which is already used overseas, could save the NHS hundreds of thousands of pounds. Dr. Hemmel Amrania is the CEO of Digistain. Doctor, good afternoon to you.
Good afternoon, Roberto. Thanks for having me on.
Pleasure. Welcome to the show. Congratulations on the award. I mean, what is the technology and how does it work?
So the technology is a way to analyze biopsies from breast cancer patients to help physicians and patients work out if they need chemotherapy. I mean, the reality on the ground today is most patients can be spared chemotherapy. And there's a systemic overuse of chemotherapy. And I don't need to tell you or your listeners, Roberto, that the effects of chemotherapy can be quite stark, especially if you don't need it.
No, of course. So how did you get to this stage with this development, Doctor?
Sure. So what we started off in, the birthplace of this technology was the NHS. The research was funded by the NHS. And it's amazing to now be in a position where we can give back to the NHS for something that's actually been cleared by the MHRA. It's got regulatory approval in the UK and abroad. And, the NHS is clamouring now to get hold of this and use it on patients to save lives.
And I mean, is it being used already or how quickly will it be introduced into the NHS system?
So, the NHS is probably one of the world's biggest employers, right? So for that reason, it just takes a long time to get things in. But it's already been used out of the UK. It's just been commissioned for use in the UK at an NHS lab in the three counties. So just stay tuned. Really, it's going to be. We're working with the NHS right now for widespread use to give the patients who previously would not be able to access a test like this at all, are now able to find out if they really can spare themselves from the side effects of unnecessary chemotherapy.
Doctor, can I ask you, is it true that the NHS sends biopsies overseas at the moment?
That's right. So when I used to work in London, in one of the top cancer hospitals there, I was shocked to discover that most of the biopsies are actually shipped off to the USA for analysis because we just don't have that capability in the UK. And that's what we're doing for the first time in the UK with a technology that was spun out of Imperial College in the physics department.
Well, that must have been extraordinarily expensive sending stuff to the US.
It costs thousands of pounds per biopsy.
So this works, and I hope and presume it's going to be significantly cheaper.
Absolutely, yeah. I mean, our whole raison d'etre is to offer this standard of care that's equivalent to best-in-class, tests today at a mere fraction of the cost of what the NHS is currently paying. And what that allows us to do, Roberto, is it allows us to test more patients for the same budget.
Well, that is good news. Good news for the NHS, good news for patients, good news for you, Doctor, CEO of Digistain. Ka-ching!
Thank you.
Well, it's got. I mean, if we can develop the technology locally and it helps, all credit to you. How difficult? You want me asking? How difficult is it for a company like yours to develop this kind of technology here and get it used by the NHS? So
it is challenging. I'm not going to mince my words there. It is difficult to get things, but that's a great thing. It's because the UK has a really high sets a really high bar for technologies, for emerging technologies to demonstrate and prove itself before it can be used on real patients, which is brilliant. Unfortunately, that just takes time. So, but as I said, this was funded by the NHS. It's great to be in a position where the NHS itself is declaring this a problem worth solving and is actually backing it with funding to carry out this research because it desperately wants this problem solved. And that's what we've done and what we've delivered on, which is incredible.
Again, well done. Dr. Hemmel Amrania, CEO of Digistain from Newport Pagnell. They developed this new technology to diagnose breast cancer here in the UK, saves the NHS time and money, because previously we've been sending biopsies to the United States. And that must have been so expensive.
Every Saturday evening from 10 on BBC.